Okay, so good evening, everyone. Today, I'm Dr. Hasnat on behalf of the Excellence for MRCS platform, and we are happy to have a live webinar with one of our successful candidates. And today, our mentor, Dr. Naida Rifat, will be joining with us, and who is also MRCS aspirant once, and he's currently working as an urology medical officer and a resident as well in Bangladesh Sheikh Medical University. And here with us, our special guest, Dr. Irfan Abdul Kareem, and who is an orthopedic surgeon in Bahrain. Basically, he's from India, and we are happy and privileged to listen live, to have the access to listen live his experience, his journey, his thoughts, and we will have some advice uh, reflecting towards the future aspirants as well. So first of all, congratulations, Dr. Irfan Abdul Karim. So
Thank you so much.
yes, congratulations on your huge success. So
Thank
so we are delighted that you have joined with us despite of your busy schedule, as you have almost one of eight or three on calls, right?
you.
So we got your schedule just because this is Eid, because of Eid, and so Eid Mubarak again. And
Thank you.
first of
Eid
all,
Mubarak to you all.
yes, thank you. So we have some questions regarding your MRCS journey actually. So could you please tell us when did you start your MRCS journey? And regarding you can start from your background as well. So just could you please start from the very beginning? How did you start your MRCS journey?
Okay. Uh, it all started just 1 year ago. Actually, I was happy because I've been practicing orthopedics and trauma for last almost 20 years. So
Yeah.
for last 15 years, I've been working in Bahrain, mainly trauma, and for the last few years, maybe around 7 years, I was posted in pediatric ortho unit.
Okay.
So basically, because nobody wanted to go there. So, everyone wants to do joints replacements, arthroscopy, sports surgery, glamorous things. So anyhow, it's a service job. I have to go military hospital wherever I'm posted. So I've been working in pediatric ortho and general trauma for quite some time. So in the beginning, I was just doing it as my job, but as slowly, I started doing more work in the field, and like lot of work being left for me to complete, especially in operation theaters. So I thought I should develop some proficiency. Uh, that's how it started. That I wanted to do FRCS International, but for that MRCS was needed. So yes, so like around 1.5 years ago, I decided, okay, I'll do it, but procrastination, because after 20 years, it's not easy to make up your mind to go back and read all the basic sciences which are in the scope of MRCS, especially when you are practicing not even a specialty or subspecialty rather.
Yes.
So it took some time for me to, decide that, okay, yes, okay, let's go ahead and do it. And then sometime in May 2024, I started preparing, no, sorry, not May, March 2024, I started, serious preparation for MRCS. So I took my MRCS part one from Bahrain in September. And to my surprise, I passed. And
2024, right?
yeah,
Okay.
so then I got a little confident, and I don't know, I calculated or miscalculated, whatever it is. But I thought from October onwards, when I got the result, from mid-October to mid-February, I think it is decent enough time to prepare for Part B.
Yes. Okay.
But when I started, preparing for part B, I found myself a little lost. It was not as simple as part A, and I was clueless how to face the exam. So I started looking for many hands-on courses, and the reason or the way I landed up with you was many of my colleagues are using the Salah course. So I wanted to attend the Salah hands-on course, the preparatory course, and the only one available was in Bangladesh. So, but when I contacted them for many days, they did not reply, and then they said they cannot help me with the visa. And being an Indian, it is not so easy to get Bangladesh visa now. So then suddenly, when I was browsing for courses, suddenly I found your course on Facebook actually. So I clicked it, and I found you, and you responded to me in minutes actually, and I had already made two trips to Bangladesh embassy. Although they are very nice people, very courteous people, but they have their own, limitations. So they wanted some proof that I am going to attend your course, and the documentation you provided within a day, it helped me a lot. Fortunately, I could secure the visa probably
Okay,
24
okay.
hours before your course, and
So,
I could, yeah.
so we'll come to this actually. Part B OSCE exam is quite a bit different rather than the part A. Part A is basically a 300 marks MCQ exam, and you don't have to face no one else rather than the computer itself, right? But in part B OSCE, you have to face 17 stations, 17 and more candidates, examiners, and patients as well in some stations. And so you have to be bold. So we have to verbalize every station what to speak and what's not to speak. So that needs particular way of grooming. So my question is, how long did you take to be prepared for the MRCS OSCE? So was it just after your September 2024 diet? And
Yes,
was
yes,
it
yes,
almost
yes.
4 to 5 months?
In October, I got the result. I think roughly around 3.5 weeks from the party exam, I got the result. And then I started looking because I wanted to finish it off quickly, because then so that I can apply for the main FRCS thing. So uh, I
Okay.
started reading. I started reading from general thing. Okay, anatomy. I started reading the whole anatomy, but that's not the approach that you need actually. So I was a little lost. I joined a couple of my friends who were using Salah course, but Salah course was, even they were not happy with what is going on there. And then I found
Okay.
you, and 2 days I could have a lot of orientation. I knew what I should do when I attended your course.
So yeah, it actually takes time to develop skills. So 2 days may not be enough. So so from October, November, December, and January, and first half of the February. So it almost
Yeah,
3.5 months that
yeah,
you have taken to be prepared for the MRCS OSCE exam, right? So basically, out of nowhere, at the end of the December, right? Almost at the end of the
yeah.
December, you actually contacted to our support, and I actually responded there. So how did you got to know about excellence for MRCS out of nowhere in Bangladesh? We are very unpopular, and we are not that much familiar to the foreign candidates at that time. So we just started, and it was almost 5.5 months that we have started these courses. So we are
Yeah.
not that much popular. So we are just very much astonished that we got a call, that one from Turkey and one from Bahrain. And unfortunately, the person who contacted from the Turkey could not manage the visa, but you got to know about us. So how was that possible?
I
So how
think it
did you
is,
got to know about us?
yeah, this is, I think, just that I was actually searching for more hands-on course in India or Bangladesh or Middle East, like that, on Google, basically. But these people have algorithms. Once you search for something, similar ads start coming everywhere. So on my Facebook page, I got several, but I found yours, and what I found was, when I opened opened your Facebook page, the feedback that many people had given, that was good. So I thought there's not much time and I'll attend yours, and going to Bangladesh is very much within my reach. And thanks to you that you responded and made it possible for me to attend that.
It's so nice of you. And that was very short period of time. Like you had almost 2 days of time, and you went to Bangladeshi embassy for twice or thrice, I guess, right?
Yeah.
So we had to give you a visa support letter on behalf of Excellence for MRCS. And just for this, you actually attended. And we are not sure that you are coming to us or not. And we actually said that just pay us after coming to Bangladesh. And what will happen if you get rejected the visa? So that was an uncertain issue. So later on, after doing the hands-on course or simulation hands-on course, how was your experience? What was all about the 3 days in GIST, and what else was about the ambience and food, and the environments and the colleagues that you have got to practice? So could you just share about the simulation hands-on course? Because this is the thing that you have taken to us, or this is the part that you have enrolled with us.
Yeah. See, this course, it deserves 5 stars, because
Okay, okay.
it was organized excellent. Probably, I think you people are a bit very generous, because the way you are hosting it, the way you are taking care of people who are coming there for their food and for their convenience, for all requirements for 2 days, it was excellent. But the most important thing was for me, uh, the skills part, where we have to do skill station. It was not that important. I have worked for 20 years, so that's
Yes,
not
yes,
the
yes.
thing. But yeah, it did help me, especially Dr. Rifat. He showed a few things which are required by MRCS, actually, the way we do it, and then okay, that was fine. But in 2 days, you covered most of the history and examination stations, and a little bit some stations you did for anatomy and pathology and ASCC also. But that gave me a good, very, very, very good orientation, like how it should be and what. Then at that time I decided, I saw your books and I bought one for me myself and one set for my study partner, and we decided that we are going to practice it the same way that went on in the course. So for every day we divided our time, and we did all sections the same way, like how you had organized your course. And at that time we decided that I have very little time. See, December end I came, and February 21st was my exam, so exactly 50 days.
Yes.
So I said, I stick to your books, 5 books. Let me be very honest with it. And I kept all other. I had EMRCS. I had some things downloaded from past tests. I had lot of things. But I said that's very complicated. If I don't pass, okay, next attempt we will see. But right now, shortcut approach. I will stick to these 5 books, which are very comprehensive, okay, and covers most of the things. I may miss out a few questions, but I can take that chance. So, and my partner also agreed for that, and we did it. We focused on doing it and doing more revisions with one book, your books, rather than studying many books and not remembering anything. And I think that helped us.
Okay, okay. So it's basically very tough to cover all the skill portion within 3 days, but we had
Yeah,
to try, and we had to reschedule the simulation hands-on course because you are about to fly on the
yeah,
third day of our course, right? So we have, because orthopedic examinations are really easy, so we had to make them on the third day, so that for your convenience. So that was the another thing actually. And but for the other candidates, orthopedic examination may not be that much easy, just like you and me, right? So that is another thing. And you came to Bangladesh and took 2 sets of our 5 volumes books, right? So
right,
you have said that the books are really nice, and yes, that is very true, that no book is actually 100% complete. So we actually admit that one. So there might be some question that 1 out of 10 question may not be included in the book, but we have tried to compile all the questions that were included in a Hyderabad exam in January, Penang exam in January, and there was Kuala Lumpur exam in January. We tried to collect the questions from our candidates, and luckily we have been able to compile that in our next edition that you haven't got that one. So in the next fourth edition, we have actually we released the fourth edition books. So that includes all the recall questions from the January. So apart from that, what was your impression that you got 1.5 months to go through all the 5 books? So what was that experience about the book?
No,
So
it's an excellent book. As I told you, it is concise but very comprehensive. It's packed with material, and because you have divided into very nicely into 5 sections. Not just that, but that when some of my other colleagues who are taking exams in April and all, they are all following the same book. Because once they saw this material, everyone thinks, okay, we need this. We don't have to go to multiple sources. Everything is compiled here. It's easy. It saves time. So
okay.
your books, my colleagues are still reading now.
Okay, okay. That is very great. And later on, you our Part B courses, right? So
Yeah,
you haven't got generally our Part B courses are actually conducted within 4 to 6 months of time frame, but you got
yeah,
only 1.5 months.
yeah.
So these classes are also actually long, almost 4 and 5 hours long classes. So so what was your actually concept or idea about our courses or classes? So what's the
See,
idea?
I did not take lot of your lectures due to
Yes, yes,
lack of time, but I did a few. Like for example, I can say if I remember very well, I took the full lecture for pancreatitis. It's around 2.5 hours, but it has got so much information, and like you people have taken so much effort to in detail explain things and make concepts very clear. It was easy. So, but I took your course mainly because I wanted to attend the mocks.
okay.
Okay. So in between where I'm having some difficulty, I used to open that particular topic and try to go through
Yes,
at a higher speed. But but this is what I did. Your course is excellent.
yes, I understand that within 1.5 months, it is really, really difficult to complete the whole courses. And to complete all the classes, it is quite impossible because our classes are
Yeah.
almost 4 to 5 hours actually long. At the Bangladeshi time, we start at 9 of the night and it goes beyond 1 a.m. or 2 a.m. of the night. So it's very difficult, and it was also unadvisable for you keeping 1.5 months left in your hand and doing all the classes. It would be really difficult for you. So I got all the things, and you are so nice and humble, and that we have noticed in our simulation hands-on course. And one thing that might be a concerning that you are not Bangladeshi, so the Bangladeshi foods may not be comfortable for you, and we don't have anything to
No,
do
no, the food was
for that
excellent.
concern.
That's
Yes.
what I said. You people are very generous. You're taking care of everything. Uh,
So, no, no, we tried our best, but it is quite difficult to look after for all of the things
yeah,
actually. And
yeah.
hopefully, we are trying to recruit more mentors so that they can look for the other things, like whenever the in between 2 sessions, whenever the candidates are practicing, we will recruit some few mentors who have also passed from the Excellence for MRCS, and they are really talented mentors, and they will actually look after what the actually candidates are participating and what are the mistakes that our candidates doing. Basically, they will try to fine tune those things. So these are the sides or ways of improvement for from us. So basically, that was all about the simulation course. You have explained it very nicely, and regarding our books that are complete, you have said everything very that everything written comprehensive and in a concise manner. Okay, so I would like to give the floor to Dr. Naizas and Rifat Bhai to say something regarding or to share his thoughts with Dr. Irfan with us.
Hello, good evening. Good
Good
evening,
evening.
Dr.
Before you say anything, Dr. Rifat, I want to, say in front of everyone that there are no words to thank you because in these 50 days, I disturbed you a lot. I know you are
No,
you're
sir.
always and
It's
very
my
busy,
really
but you
pleasure.
took time
It's my
every
pleasure.
time to clear any doubt or to talk to me on long distance calls. Thank you so much. It
No,
helped me a lot.
I'm extremely pleasure, sir. It's not a big deal. It's my job, and I'm extremely happy that you have passed in the very first attempt. Okay, thank you, sir. Congratulations, and I think, and also congratulations to Dr. Hassan, who is giving the so much and tremendous effort to run the Excellence for MRCS OSCE, and as well as the MRCS Part A course. Basically, almost just 1 year back, just 1 year back, I was thinking to start the MRCS course for the Deshi candidates at least, because I used to do the mentorship for the for 3.5 years for the MRCS Part A exam. But after passing the MRCS Part A exam, my candidates are looking for or going here and there to have the guidelines for the OSCE, but they didn't get the proper guideline. They fall in a very difficult situation. How to overcome this situation? They are just asking me, Bhaiya or Dr. Rifat, would you please start the OSCE course so that we can pass? Would you please start the journey? And definitely will follow you. So after thinking a lot, I decided to start the OSCE course, and basically it was only or solely focusing the previous candidates who has passed the MRCS Part A exam with me. So I was just focusing on that candidate, but it's my good luck that many of the people are joining with us, and almost it's a 300 plus family compiling both the MRCS Part A and Part B. And really, I am really grateful to you that you guys are believing me. And I don't know how did you get us? And it's a huge decision that you are flying a very big distance from Bahrain to Bangladesh, and it's a big decision. I don't know why did you believe on me. Whatever, Dr. Irfan sir, you passed in the very first attempt. Okay, my thinking was because from my previous experience, I am seeing that the elderly candidates are failing much more than the younger people. If I'm not
Yes.
wrong, I
Yes.
think all of you will be agreed with me, because it's really easier to handle the junior candidates because they don't know nothing. Like they are very naive. They come us with a very short spectrum of knowledge, and we can guide them properly. But as you are a consultant or orthopedician, so whenever we are doing the examination, whenever we're doing thinking anything about the OSCE exam, and it was really tough job to do such thing in front a consultant like you. It was really tough decision. And I told you the younger people are passing very easily, but the elderly people are failing much more than the younger people. So there are several causes. One of them because they don't get the enough time, and another thing, they are much more basically experienced in certain spectrum of knowledge, like you are from orthopedic background. Like, so whenever you go for the examination of orthopedics, so you will find some clues, like you are getting the like some knee examination, you are getting the posterior droid test positive, like anterior droid test positive, so McMay test is positive, so whatever. So if one examination is positive, then you don't have to go for some other examinations, like this thing happened. But in the MRCS OSCE exam, these logics are not applicable. You will have to follow the rules, that is, will have to follow the techniques or rules that is given by the MRCS or Royal College of Surgeon. So it's a really difficult job to follow these rules blindly. and that's why I told you for senior candidates are failing much more. But I'm really surprised to see you being a senior candidate like you passed in a very short period of time, and within and you are so much dedicated. And one thing I was just saying, Dr. Hasnat, Dr. Irfan sir is so humble, so humble. I haven't seen such a people, and I am not seeing this kind of people in a regular basis. How a people become so humble, and it's my really great pleasure to have you in my simulation course. Okay, another thing, sir, after having the simulation course, whenever you go back to the Bahrain, you called me and you wanted to enroll our course. Just right now, I want to hear, just before the 1 month and 1.5 months back, how did you why did you think that you should start the course with us? No problem. If anyone would like to come in front of the camera, no problem, you can invite him or her.
Okay. Uh, no, when we started reading, we thought, especially I did your full anatomy course.
Okay,
I read
okay, that's
the
great.
anatomy book, although it's the most voluminous book. Excuse me. But I thought I was curious, like okay, like when you're teaching, what you're giving. I can read it because anatomy book, especially, you have given so much of illustrations. It's not like a regular anatomy book. It's focused on the way the exam is conducted. Once you face the exam, you know what you have given in the book.
Yes,
So
yes,
I was
definitely.
very curious. So I thought I'll take once. I didn't know the length of your lectures and everything. So I did the full anatomy thing, and thank you so much. Especially the head and neck and brain.
Yes, it's a
The way you have
tremendous, it's a
explained.
huge,
Yeah, yeah, yeah,
huge.
yeah, yeah. I read it twice before actually listening to your lectures, but it
That
was
was very
really,
lengthy
really
class.
helpful. Really helpful. Yeah.
Yes, and I told you while I was just taking the orientation class, I told I used to tell every single participant that in the anatomy section you will have 3 stations, and write it down. You are going to get 1 station from the head and neck, and if you are lucky enough, you might get 2 stations. Like one is brain, and another one is neck as well as the thorax. So this is very famous and favorite station that is given by the Royal College of Surgeon. So regarding the skill portion, I would like to know from you how the skill portion help you, how experience for the MRCS or skill helps you in the skill portion.
Uh, if I had not attended your course, I would have just gone and done it the way I do in
Yes,
ER
yes,
or theater. Okay. But as you said, the Royal College of Surgeons wants things in their particular way.
yeah,
So we rehearsed, me and my partner, we saw how you taught and what all you stressed.
yes, yes.
Actually, the way we are practicing it here in our military hospital is not much different from what Royal College Surgeons want. But still,
Okay.
we focused on we should not miss the steps. I
Yes, yes,
remember you both saying thing many times. It's an actor. There are no findings, but there is
yes,
nothing. But it's you have to learn to act and do all the steps.
yes,
So
yes.
we rehearsed on that, and believe me, when I went for my skill station abscess drainage,
Okay.
so they gave me that, and it was a Filipino lady actor, and like she was told to do it, do her part of acting in a certain way, but like she would start her questions like before even you do your WHO checklist or anything. She said, what should I do after this?
Yes,
So
yes,
the candidate goes somewhere else. So but
yes,
because I had rehearsed, I did it. I reminded myself one thing: don't lose the steps.
yes,
Do
yes,
it in
yes,
that sequence. And when I
yes.
finished it, it was around 6 minutes. The examiner said no questions.
Yes. So basically,
So
I used to say always in our course as well as whenever I get the chance. Basically, I tell the candidates like you used to do the so many larger operations, so many major operations or minor operations, whatever. You might be a professor or something else. No matter, it's not a big deal. the RCS will always look for whether you are following their rules or not. That's very important. If you do stick with the rules, if you do stick with the 10 step approach in the procedure station, you are going to pass in the exam, because every single station or every single steps do have some marks. So like in your station, whenever you are wanted to check the WHO safety checklist, so they notice that you have mentioned or you have uttered the you would like to check the WHO safety checklist. So they have given you the mark. So if you would skip this portion, you would lose the mark. So that's why they wanted to go forward. They have noticed you have
I'd
mentioned
like to add one thing that
yes,
yes,
yes.
and you have you have also given the advices on time. So that's why the examiner said no question.
And I told you, especially in the and I emphasize in the simulation course, especially whenever we'll do the procedure station, you'll go for the incision or you'll go for the drainage. Simultaneously, you'll have to speak with the actor, right? So if you don't speak with the actor, if you don't keep talking with the actor, the examiner will take the plot, and suddenly they will ask you some difficult questions, and ultimately you will fall in very difficult situation, and you will stop doing the procedure. You will have to look forward with your consultant, and you will lose all the time to finish your procedure station. So these things are nothing but the practice. I think the main key to overcome the skill portion, practice, practice, and practice, and definitely under the supervision. Like I have seen so many of candidates who, even in my time, whenever I appeared in the exam, one of my senior colleagues who failed in the fourth attempt in the exam. And after failing the exam, he was saying he is also from the orthopedic background. He was saying, Dr. Rifat, I worked so hard. I have gave so many of emphasizes more than you even. I have appeared so many times. So still, why did I fail? Because I have given every single thing. So I think the main concept is you have worked hard. You worked hard. You have given so many of efforts, so many of emphasizes, but always you'll have to practice in a very proper way. If you can't practice in a very proper way, definitely you can finish the procedure station, whatever, no problem. But you'll have to perform in a proper way, in a very corrected way. If you don't know the corrected way, so no matter what, you may finish the procedure station, but still you will fail the exam. So knowing the very perfect way to you'll have to know how to finish the procedure station within the time, within the examination within the time is a very important thing. So if you can practice, you will fail. So always I do keep saying for our candidates and junior colleagues, just practice, practice, and practice to overcome the skill portion, and definitely under the supervision. You'll have to practice under the supervision. Anyone who has passed the MRCS OSCE exam, just call him and practice in front of him. So don't practice by yourself. Keep someone besides you so that they can got the findings, or they so that they can they can get the difficulties you are doing, mistakes you are doing. So this thing is very important. So I think we have taken so many of time. We
No,
are
no, it was a
done.
pleasure.
Dr. Hasnat, do you have anything to say?
Okay, so Dr. Irfan sir, so what could be your advice to our future candidates who are about to face the exam in future?
Some of the candidates who have access to my ID in Telegram, they asked me exactly. So I have told them the same thing, that instead of going to multiple sources and studying, stick to one, do more revisions, and practice and rehearse. I remembered one thing that you told us that when you talk to the patient, make eye contact, and you used to repeat one word always: show empathy to the patient. So I think I was remembering your words, they were echoing in me. And I think these are few things that comes only with rehearsals. You have to two, three of you make a group and, rehearse.
Yes, MRCS OSCE is not that kind of exam like Part A. Like Part A is reading by myself and delivering it into the exam hall. But in Part B, we have to act in front of an audience. Here, the audience is the patient and the examiner. That is quite a difficult thing, as Dr. Rifat said. And this performance has to be in a just formulated manner, under an expert guidance. So if you practice in a wrong manner or in a just not accepted manner, so in that case, your all the hard work may go in vain. So it has to be in a supervised manner so that everyone can just make the journey with ease. And that was very much fruitful. And you have made this one within 3.5 months, because a person like a senior colleague like Dr. Irfan sir, in that case, who has been practicing orthopedics for almost 20 years. And it is quite difficult, as we have seen in our country, those who are practicing in a specialty or subspecialty for almost more than 10 years, they find it difficult to pass the MRCS OSCE. In that case, you have made it within 3.5 months. That is quite brilliant. And I have to say, you are a genius, obviously.
No,
And
big
definitely,
credit goes
and
to you actually.
especially
If I had
really, really
not come to
hardworking.
Bangladesh, it was not possible.
And you are so dedicated, sir, and so hardworking. And I already said that I was really surprised to see you. Such a people can be so hardworking, so generous, and so effortive. So I think we are ending of our session. So especially I would like to say thank you very much, sir, and congratulations once again from on behalf of Excellence for MRCS, and
Thank you.
especially believing us and flying a lot from Bahrain to Bangladesh. It was a big decision for you, and it was a surprise for us as well.
No, but
So
it was very fruitful. It was worth it, more than worth
and
it.
and no problem,
Uh,
sir. And one thing, I especially always was connected with you because I can remember even before going to the exam hall, you asked me about what the dress code should be,
yeah,
and
yeah,
I have sent you my
yeah. Picture, yes,
picture
yes.
on the exam day. And even after the exam, you have sent me all the questions you have been asked in the exam, and
Yeah.
we already have included almost all of the topics in our book. So our books are updating or upgradation of our book is a continuous process. So whenever any candidates appears in any center all over the world, we do collect all of the questions and include in our book. That's why this is the most updated book, and you have already noticed, and you took from you and from your friend already. So thank you very much, sir, and
Thank
thank
you.
you so much. I'm grateful to you for
And let me
believing
also
me.
congratulate you. You are doing a really excellent
Yes,
job, and keep
Thank
it
you,
thank you,
up.
thank
sir.
you.
God give you
So
strength to continue for a long, long time.
if you face any question in our further journey, so we are always here to help you in your future support. Thank you, everyone.
Thank you so much. Thank you
Thank
so
you, sir.
much.
Assalamu alaikum.
Take care. Wa alaikum assalam.